This is the national database, which has three databases. One is the Kovid database, then is the ICMR testing database, and then the India portal, Covid India portal of the Ministry of Health. This has data of 94 crores, 47 lakhs, 9,598 individuals as we speak today. Partially vaccinated are around 15 crores, fully vaccinated are 73 crores, and unvaccinated are 5 crore still. So that is the data. Vaccine effectiveness in mortality prevention in person time years has been measured. First dose is responsible for 98.9% vaccine effectiveness. And if both doses are given, then it is 99.3% effectiveness. And here you can look at the vaccine tracker right from 18th of April right up to the 20th of February that we are showing you, how mortality has reduced and how we have had unvaccinated individuals. During 2022, unvaccinated individuals were 92% responsible for all the deaths. So the number of deaths that have been talked about by Love Agarwal, the 92% of those deaths have been because of unvaccinated individuals. And this is data from 3 databases with more than 94 crore population, one of the largest ever in the world. Now, if you look at the international comparison of cases, only cases, deaths I'll come to next time, just the cases during the first wave, during the second wave, and during the third wave. If you look at the graph on the left, we can see several countries, whether it is Russia, whether it is United Kingdom, whether it is Brazil, USA, Canada, and India. And we have tried to put other countries in the background in the second graph and just show you what is India's number of cases, how the first wave was distributed. The second wave cases were there, yes, and the third wave cases were much, much smaller than anywhere. I mean, look at the peaks of different countries across the world, South Africa, USA, United Kingdom, and you can see this. This is data from the international database, World Data, and you can access it anytime. It's in the public domain. And you can clearly see how the Indian graph is more or less very much lower than what you see in the other countries, and many of them being developed countries. This was the cases. Now we have a similar graph on deaths. If you look at deaths, this is showing you the deaths during the Omicron upsurge. And if you can see different countries, same again, we find that Indian graph is on the right-hand side. It is superimposed in the first ones, and you can look at all the developed countries, United States, Brazil, United Kingdom, Canada, and here we see India, and then there you can see the right extreme right hand, a little peak of that you are seeing the number of deaths in Omicron, and you can see the much larger peaks in the other countries, wherein we find much larger peaks in terms. Why has this happened? Why did we find much lesser number of deaths or cases in India during the Omicron surge? Because of vaccine development. We had our own vaccine. We had the excess production, extremely excessive production of these vaccines. We had a rapid deployment with our frontline healthcare workers, and I'll tell you the numbers in the next slide. We had tremendous amount of vaccine acceptance. Again, credit to all the media, credit to all the communication strategies, how vaccine acceptance was responsible for such a wide-scale coverage of the vaccine, which ultimately protected India. You can see the high vaccine coverage, and that is because of a political commitment, because of a well-established universal immunization program for the last 6 decades, which has got, where we have 2.3 million ASHA workers, 3,48,000 and 28,000 private vaccination centers, 3,48,000 public and 28,000 private vaccination centers, which were responsible, and India emerging as a vaccine manufacturing superpower, and we already have been established as a vaccine deployment superpower in terms of the coverage that we have been providing for the last 6 decades in our universal immunization program. We have demonstrated to be an IT prowess with the Kovid app, with a open source platform which has electronic appointments, electronic scheduling, electronic QR coded certificate for vaccination and reminders. And then we have citizen participation with self-help group, local governments, which have really contributed tremendously in this excellent high vaccine coverage drive that India has emerged. And if you look at some of the hospitalization data for the third wave, I have presented it in the past, but I will talk about it again, comparing the fully vaccinated and the unvaccinated. The deaths was 10.2% in the hospitalized patients versus 21.8% in the unvaccinated or partially vaccinated. And 91% or 80 to 90% of these people had comorbidities. And this is a striking impact of vaccination, which is clearly documented, published, available in public literature. And this is a summary slide showing you how our vaccination drive, which is the orange line, and how the case fatality rate from April 2020 to January 2022, how the case fatality rate has been falling as the vaccination has been going up, mainly from July, August, that it really peaked up and it really fell last.